Welcome to IM Updates. This is Yan. In this episode, we'll cover key international guideline updates, new FDA approvals, and real clinical changes in practice from May 15th to May 22nd. Here's the overview. On May 15th, the journal Gastroenterology published 2026 AGA expert review on the management of C. diff infection in patients with inflammatory bowel disease. Compared with the 2017 guidance, key changes include fidaxomicin is now preferred due to lower recurrence rates. Vancomycin is reserved for when fidaxomicin is unavailable. FDA-approved therapies like fecal microbiota, roibiota, and fecal microbiota spores like Baust are now recommended for patients with at least one recurrence. Advises continuing immunomodulators, biologics, and small molecules inflammatory bowel disease therapy during C. diff infection. It also stresses that uncontrolled inflammatory bowel disease worsens outcomes. Steroids can be used if necessary, and anti-motility agents may be considered in specific patients to manage ongoing diarrhea. On May 17th, the WHO published Infection Prevention Control Guideline for Ebola and Marburg disease 2026. Most recommendations for Ebola or Marburg are based on very low certainty evidence, primarily from simulation studies and field experience. Key shifts from previous guidance include more nuanced PPE recommendations based on risk level. For example, no PPE for screening if over 1 meter distance and no touch technique possible. Medical mask plus eye protection plus gown plus 1 pair of gloves are needed if screening less than 1 meter distance. Medical mask plus eye protection plus coverall plus 2 pairs of gloves are needed in triage. Coverall plus head or neck cover plus eye protection plus medical mask plus 2 gloves plus apron are needed in direct patient care. In cleaning or barrier teams, PPE is same as direct care, but add on heavy-duty outer gloves, heavy-duty apron, and waterproof boots. Explicit recommendation against spraying health and care workers, which is previously common practice. Dead body disinfection is not required. Alcohol-based hand rub or soap water are strongly preferred over chlorine for hand hygiene. An IPC rain approach is formalized as a strategy for outbreak response. On May 20th, the American Society of Clinical Oncology published Treatment of Multiple Myeloma as Co-Living Guideline, version 2026.1.1. Teclistamab plus daratumumab is now preferred option at first relapse, alongside cilta-cel for eligible patients who have not previously received BCMA-directed therapy. However, it is not recommended for patients refractory to anti-CD38 therapy. Updated algorithm for relapsed or refractory myeloma emphasizes cilta-cel or teclistamab plus daratumumab are preferred options at first relapse if BCMA naive and anti-CD38 sensitive. Other options include ide-cel, belantamab mafodotin-based triplets, or other triplet regimens, for example, carfilzomib, pomalidomide, or cyclophosphamide-based therapy. If CAR-T or teclistamab plus daratumumab are not feasible due to rapid progression, frailty, access, or tolerability, doublet therapy is reasonable. Bispecific antibody monotherapy may be offered to eligible patients, including older or frail patients, based on shared decision-making. On May 21st, the European Respiratory Journal published the 2026 ERS ESG ESTS Clinical Practice Guidelines on endobronchial and esophageal endosonography for the diagnosis and staging of lung cancer. 6 major areas where clinical recommendations have changed since the previous 2015 guideline. First, systemic EBUS-TBNA is now the explicit standard. Second, combined EBUS plus ES-FNA is ideal, but systemic EBUS alone is acceptable. Third, no more add-on mediastinoscopy after negative systemic endosonography. for ESB-FNA is now a valid alternative to ESFNA for left adrenal gland analysis. 5. PD-L1 assessment on EBUS tBNA samples is now recommended. 6. No evidence to routinely use alternative needle sizes or cryobiopsy for lung cancer diagnosis or staging. On May the 21st, the European Society of Cardiology published clinical consensus statement on heart involvement in eosinophilia. Highlight findings include a recent genome-wide association study that identified GPA33 and IIF1 IL5 as susceptibility loci in patients with ANCA-negative eosinophilic granulomatosis with polyangiitis, or EGPA, which provides the first evidence of distinct immunogenetic mechanisms in this subgroup. For the first time, the statement acknowledges the emerging role of direct oral anticoagulants as a reasonable alternative to warfarin. Mepolizumab is now approved for idiopathic hypereosinophilic syndrome, or HES, and EGPA, and cites the recent Mandara trial, which demonstrated that benralizumab is non-inferior to mepolizumab for inducing remission in EGPA, with deeper eosinophil depletion. These agents are recommended as steroid-sparing options. Another critical update is the emphasis on tissue-restricted HES, because peripheral blood eosinophilia may be absent in a subgroup of patients with eosinophilic heart disease. Detecting tissue eosinophil infiltrates via endomyocardial biopsy is critical in diagnosis. It also cites evidence supporting speckle tracking echocardiography, in which a global longitudinal strain less than 17% can predict subclinical myocardial dysfunction in patients with HES, offering a more sensitive screening tool than conventional ejection fraction. Move on to new FDA approvals. On May the 22nd, the FDA approved Dato-DXd, the brand name is Datroway, for adult patients with unresectable or metastatic triple-negative breast cancer who are not candidates for PD-1 or PD-L1 inhibitor therapy. In the trial, the major efficacy outcome, median progression-free survival, was 10.8 months in the Dato-DXd arm and 5.6 months in the chemotherapy arm. Median overall survival was 23.7 months and 18.7 months in the respective arms. Confirmed overall response rate was 64% and 30% in the respective arms. Warnings and precautions include interstitial lung disease and pneumonitis, ocular adverse reactions, stomatitis or oral mucositis, and embryo fetal toxicity. So much for today. Hopefully enjoy your weekend and see you next week.